And okay, yeah. So welcome, Mwalimu Tom. The Thesis Gumzo is a student-led initiative, or student-centered actually initiative, where we have tried to demystify this process of research, of our research process, and also to understand what it is also about, but also to make it a normal human experience, especially as psychologists in training, so that we see what, for me, I know personally, the struggle I've had is, one, will I even understand these terms? Will I understand this process? Will I make it? Will I graduate? Will I complete my paper? Will I defend? And in the struggle, one of the things I've learned in struggle is that I don't necessarily have to struggle alone. And secondly, that you can never have enough help, provided you ask for it. So that's what the Thesis Gumzo is about. And then also, the principle is also, if you want to walk alone, walk fast. Or if you want to walk far, walk with others. So the others in this conversation are my colleagues who are doing their thesis, and we are divided into two. So there's students who are taking their masters in clinical psychology, and the others are taking masters in counseling psychology. We are all Daystar University students at different stages of our thesis. And yeah, so that's who we are. And as our guest today, we can see their names, but is there something you'd like to hear from each one of us that would support and help and guide you in your presentation today, Dr.
Thank you, Chris. I'm not planning to do a presentation as such. Mm-hmm. My expectation is that we will take the work of different people, mm-hmm, and we discuss the stage they are at and look at some of the tips to maneuver through the challenges that they're going through, so to speak.
Okay.
Yeah.
All right.
Yeah, so we'll have an exercise where we will take each person's topic. Mm-hmm. We look at the different variables and how they are relating. Okay. And then we see how this conceptual framework can act as a guide to the different stages of your research. Okay. Your research process, yes. So I actually don't have a presentation. It's just a one-page document that we will fill for the persons who are willing to share. Okay. And then from there, we can see how to go about, depending on the questions that the person has. Yeah.
All right. Okay. All right.
But maybe what I would want to know first is to hear from each person.
Yes.
What is their motivation of either studying counseling psychology or clinical psychology?
Okay. All right.
Yeah, what is your motivation, just from the beginning? Yeah. So perhaps we could take a round.
Okay. Yes. Yeah, that works. And we'll start. I'll go maybe the way the names are showing up on my screen. So Tabitha Gilbert, what is your motivation for studying counseling psychology?
Good evening, everybody.
Good evening, Tabitha.
Thank God for the opportunity of being in this group. My motivation for I'm doing counseling and psychology. I'm working with the Ministry of ICT, where they sponsored me for this course because obviously you have to request that you will be sponsored. But my aim is that I can give back, maybe even I can help the community or even the civil servants when I'm working. I can help them to know that there is still, when somebody is depressed, we can share and we can debrief somebody on what is going through, and maybe I can help somebody to change their perspective. So I'm working hard to see what will happen when I finish and when I graduate, because I'm still in the ministry. And the thing is, I want to give back to the community even after I've retired. I can help somebody, or I can share in the community and give hope where there is hopeless through the knowledge I've gained from at least university. Thank you very much.
Thank you, Tabitha. Abel. What's your motivation?
Yes, Chris. Yes, Chris. Thank you very much for first of all for this organization and always being there, tapping our shoulders and backs, this journey. Thank you, Chris. Okay, so for my colleagues, I am Abel Jero. I am actually a Catholic priest for the past 15 years, and I work in Don Bosco Church down here at Upper Hill. And so in my ministry as a priest in so many countries I've passed through, and also places in Kenya and Tanzania, the need to accompany human beings, not only in their spiritual domain, but also in other domains, psychological domain, social domain, has become very clear that we cannot just be praying for people when they have problems, and yet we do not explore the social and psychological sources or dispositions that dispose them to be experiencing problems. That is one motivation for me to study counseling psychology, and I'm loving it. I'm so happy. I have even grown a lot as a priest and as a pastor through these psychological studies. Basically that, Chris.
Wow, thank you. Thank you, Tabitha and Abel. Yeah, it's like I'm meeting you all for the first time when I'm hearing these motivations. Opa.
Yes, Chris. Thank you.
Very good.
My motivation, I was actually trying to think what made me be interested in counseling psychology. In early 2000, when the tourism sector was affected, that was my first career. I was a travel consultant. I decided to switch, and so when I was still a travel consultant, I discovered that I used to listen a lot and just being there for people. And I discovered so many people were coming to me. But other than that, in church, I used to work with adolescents and pre-adolescents. And so I discovered it was one of my talents. And so that was a major factor for me to go and study counseling. So I started with certificate. I wanted to see how it is. Then I moved to diploma. Then I still had the thirst. I did an undergrad, but it was not on psychology. It was on leadership with an aspect of counseling. And then in my master's, I decided to do counseling psychology because we don't have child psychology in Kenya. So that is where I also decided to register for child development. Yes, so that is my passion. I like working with children and I like working with adolescents. So just to continue, and I know what our guest had asked about what we are actually writing on, I'm concentrating on adolescent boys. Since girls, we have been empowered quite a lot more than, so I'm just trying to see how best maybe my paper, my research could support boys, adolescent boys. Thank you.
Thank you, Opa. Thank you. Yasmin, karibu.
Asante, Chris. I'm Yasmin Hassan. I'm doing master's in clinical psychology. I work with the Directorate of Criminal Investigation, Kenya. Currently, I'm based at Parliament, and actually the DCI is sponsoring my course. the motivating factor is that, okay, first I started the previous speaker, I started in the lower levels. I started a diploma in counseling psychology. I was still with the police. Then I did undergrad in counseling psychology, and now a master's in clinical psychology. The motivating factor is that we all know there's a massive concern across the world when it comes to mental health, and we all know the trending things around the security sector when it comes to mental health. And that's my motivating factor. I'm trying my level best to get to know what is the leading cause of mental health issues among people in uniform. And that's also my part of my thesis research question. I want to know how the psychosocial factors affect in the service delivery among police officers in Kenya. Yeah, thank you, Chris.
Thank you, Asmin. Yeah, thank you for your share. Genevieve, karibu.
Thanks, Chris. Good evening, everyone.
Evening.
So I can't say that my reason for studying clinical psychology is deep. I just came back to school for some self-exploration, self-development. It's very me-centered. So yeah, that's why I'm here. In fact, I wish I could tell them that I have already achieved what I came for. I could just leave, but it's okay. I'll hang in there till I'm done. So yeah, thanks.
That's deep, Genevieve. Like really, when starting with self. So I just want to affirm that it is.
Oh, thank you.
Linda had sent me a text, so I'm not sure what it was. Linda, you can speak?
Yes, I can speak now. Sorry about earlier. My connection was really bad. I was on the road, but now I'm somewhere I can communicate.
Okay, cool.
Well, for me, my name is Linda Onyuka. I'm pursuing an MA in counseling psychology. My background is in banking, but I'm no longer a banker, but that's my background. For the better part of my life, I was a banker. But for me, what I would call my light bulb moment was when I was in India, taking care of somebody close to me. I was there for almost a year with a patient. And while I was there, I sort of just noticed that the caregivers, us, were totally neglected in terms of our emotional needs and the things that we go through, or rather we went through. And we sort of used to turn to ourselves for that support, although none of us were professional. But I just found a lot of people gravitating towards me, although I also had the same burden as them. And I just sort of felt I had that natural thing in me just to support people. And so that was my moment when I thought, why don't I pursue this professionally and see what I can make from it so that I can be a better person, or rather a better helper who really knows what I'm doing, although they seemed to get some relief from my, what I would call psychosocial support, but I wasn't doing it at a professional level. I sort of just had an incline and a talent, if I would use that word for it. So that was when I made a choice to pursue this career actively when I got back home. And so for me, that was the turning point for me, or rather that was the starting point for me. That was what led me to pursue a degree in psychology, if I was to call it that, counseling psychology. So that's how it all came about for me. Yeah.
Thank you. Thank you, Linda. And like I'm saying, I'm loving these introductions because it's like I'm meeting you guys for the first time. Kamore, for those who have just come in, we are sharing the motivation for doing this, for studying. Yeah, Dr. Thomas has asked if we can just share our motivation for studying Masters of Counseling Psychology or Clinical Psychology. So what's your motivation, and welcome.
Hi, Chris. Hi, everyone. I'm down with the flu, so today I am not actively talking. And I am in bed very early. I'm supposed to be in bed 12 hours after now. But anyway, so what motivated me to doing clinical psychology? I went through a series and phases of mental health issues in my life and had a lot of misdiagnoses, a lot of judgment here, a lot of talks from people. You look so strong for you to go through something like this. And I really wanted to understand why people could not understand that anything to do with psychological issues can happen to anyone. It doesn't matter whether you're the president, whether you're beautiful, whether you're this, anyone can get into that. And so my motivation for doing this is to be able to create a lot of mental health awareness out there. It is also my retirement plan. You can practice counseling or clinical, being a psychologist, you can practice it maybe up to 75 years. So it's also a retirement plan for me. Thank you.
You can. What's your research area? I think there were people, I think there was also that question I'd forgotten to ask.
My research area, I'm doing a research on psychological issues pertaining psychological issues affecting call center agents in Kenya, case study Safaricom PLC.
Okay, thank you. Nancy, Karibu, what is your motivation for studying this course and what's your research area?
Hello, Chris, thank you.
Karibu.
Yeah, I came in a bit late. My network was misbehaving, but I'm glad to be here. Yeah, for me, I'll say that for as long as I can remember, I've always loved encouraging people and listening to their stories. And I'm a former banker. So my background, I did in economics and sociology at the university and a minor in literature. I love writing. You're aware I have some books. And then when I was in the banking industry, I just found myself, I think it was divine. Everybody who had an issue, from the manager to the, the staff and even the customers, they would all come to me. And so along the way, I realized that I needed to learn more on counseling and the psychology of human behavior. And so by the time I was leaving the banking industry, that is actually exactly 9 years. Exactly 9 years ago, I knew that I had interest in counseling because I loved mentorship. And I realized that most of the people who are having a challenge of, even making it in life, because I'm passionate about that, they are not aware of themselves. And that is what motivated me to study counseling, so that even I can be empathetic and so that I can understand where someone is coming from. And I can say so far, so good. My research area is on psychological impact of infertility because I have a special interest in that specific area of infertility and how it affects the family. Yes.
Thank you. Thank you, Nancy.
It's okay. Welcome, Chris.
Okay. RK, Karibu. RK.
Yes, it's Rose Chalo.
Oh, okay. Hi, Rose.
Hi, Chris and everybody. Thank you. Yeah, my motivation for taking a master's degree in counseling psychology is because I have found myself helping in situations, in social situations, in church, in family level, with friends. Close to what Nancy has said, just people seeking your counsel, your guidance, your intervention. And I didn't feel, or rather, I felt there was a gap I had that I needed to fill with training and skills. And so from long time, I had desired to be in school to learn counseling psychology.
and just get the skills that I felt I didn't have, so that when I help, I can help better. And yeah, I feel I am actually getting there. I feel like I am getting what I set out to get, to a great extent. I find myself doing things better than I did then. Yeah, and my area of research is on psychological issues affecting adoptive families. Thank you.
Thank you. Thanks, Rose. Peter, karibu.
Yeah, hi, Chris.
Hey, Peter.
How are you, my brother? Okay, so now thank you very much, and good evening to everybody who is in attendance. My name is Peter Onyango. I'm taking a master's in clinical psychology, and my motivation are threefold. So the first one is my background is nursing, so I had a degree in nursing, and I've been working in the community a lot with different NGOs. And I realized that I was coming across several community members who needed mental health, who needed some intervention in mental health, but I was not well equipped to be able to help them as much as I could help them in terms of physical health. And looking at the WHO definition of health, there's no health without mental health. So that's the first one. The second one also is as a medical worker, I also noted that there was a gap in mental health specialists, and I would like to pursue this to the highest level so that I can be a specialist in clinical psychology. And then thirdly is my area of research is caregivers, and mainly caregivers of mental health clients. And those are the people I've encountered, and I also have very close people that I've come across who need that type of care. And I really would like to take care of caregivers. I believe caregivers also have a lot of mental health issues because they're taking care of their mental health, mentally ill relatives. So that's an area I would like to pursue and see how best I can help. Thank you so much, and I'm looking forward for the discussion. Yeah.
Thank you, thank you. Yeah, I guess maybe it's my turn, and doing masters in counseling psychology. Really, it was just because mainly at this time it's because it was the next thing. It was the next thing because what I really wanted, I'm interested. There was a unit in undergrad, also at Daystar, that I really liked. And it started very rough, if I may say, social psychology. And towards, and then by the second class, I was complaining, we have to have a theory for everything, for love, because and then by the next week, I came very sheepishly, and I said, oh, sorry, Mwalimu, now I understand the place of theories in academic life and generally in understanding life and making sense of life. But I particularly enjoyed that unit because where they said, it's social psychology, the study of how, groups affect individuals, or individuals affect groups, or groups affect groups. So the next thing I really would have wanted to do was, I was interested in, anthropology. I don't even know what it is really, but that's what I was looking for. And I said, okay, this is the next thing. And also, Daystar was going through a transition at the time, with a new vice chancellor, and being an undergrad during the turbulent times, I had a vested interest in seeing this new dawn because I was involved in the previous, during that process. So all that, so, it was just the thing. But even going back to school was also, I've met people who say they are self-taught, and I'm not that kind of person. I will learn but under the context of something, you know, I wanted even to have access to a library, even though there's a public libraries, but I did not want to take myself just to read anything and everything. So, so for me, and we have a joke among some friends of mine, you know, counseling psychology is team human. See catch feelings, well, see counseling psychology. And so that's, okay, and then, okay, there was no MCP yet at the time. However, I'm also interested to see how psychology can make a difference in, you know, like we're saying about community, you know, from at a communal level, rather than from the individual to the next individual. And my research area is also, because what got me into psychology was that I was an addictions, still am in many ways, interventionist. You know, family members would call me and ask me, you know, get me a cheap rehab. And before I used to give them that information, you know, I gave them the cheap rehab. But I've realized was not the answer they needed. It may have been the answer they wanted, but it wasn't the answer they needed. So now I'm able to start a conversation when somebody calls and wants the name of a cheap rehab. So it's just to see how, even in the addiction field, because that's the access I have right now, how psychology, particularly, you know, for the addicts, you know, can be, you know, can help them deal with the stuff. There's a lot of unresolved issues, and beyond maybe just putting the drink down or putting the drug down. And hence, even my research area is around, you know, I wanted to talk to recovering alcoholics to hear from them about the impact their families played when they were using, when they were drinking, during their intervention and rehabilitation, and now in their recovery. So I just want to hear what they think. And maybe at the next level, I want to hear from the families what they think about their addict. And also particularly, my study, you know, the recovering alcoholics in Alcoholics Anonymous. And this is a peculiar population because there is no register. You know, they don't have a register, they don't have, but I have access to them. And there's literature, fortunately, about it. I have access to them. And the gap is there's not much study about Alcoholics Anonymous in Kenya. And yeah, when I look at the NACADA studies, pardon me, Daktari, but you know, there was the prevalence amongst university students, prevalence among, so I'm saying, where do these people go, you know, when the prevalence studies are done? So that's the access, and yeah, so that's access to the research area. But I really would want just to have a language to be of a language of, yeah, to help people and to make a difference in people's lives. Yeah, in the last 2 weeks, 2 people have called me wanting to get into the industry, you know, to ask what courses they should do. I don't know whether I need supervision, because at the end of those 1 hour calls, because they ended up being 1 hour, I did not send them to any university or college or whatever to start enrolling. I said, let's start looking at ourselves and see what it is really you want. Why? Because one of them expected me to invite them into a session. They see how I'm doing it. And the other wanted to know which institution, where to start from, whether it's certificate. And maybe I need supervision on that for after this class and after this session, so that I can see, did I do the right thing in directing them? Because we also the well-being of the industry. We are gatekeepers in that sense. Welcome Anne and welcome Lucy. We were just introducing ourselves, asking if you can quickly, not quickly, I mean just karibuni, because you're part of this group now, where we're just sharing what our motivations for studying counseling or clinical psychology is. So Anne, would you like to quickly introduce yourself? And then followed by Lucy.
Thank you, Chris. My name is Anne-Marie. Doing clinical psychology. So my motivation is just to have a deep understanding of mental disorders, psychological disorders, and of course, understand how to test and to administer tests and give therapy as well. So I just want to deepen my understanding of clinical disorders and how to, to intervene and when to refer. So that's it. And I'm happy to be here. Sorry I'm late, but I believe even the next few minutes I will gain something from this. Santa.
Thank you, Anne. Lucy?
Good evening, Chris. Good evening, everyone. Sorry for coming late. My motivation to join clinical psychology was I'm coming from a background of health. I'm a nurse, and all the time I have known that mental health is neglected, and so I have always wanted to narrow down to something that can resonate with some impact on the area of mental health. And so when this opening came for clinical psychology, I felt that I have landed where I have always wanted to be, so that I can help people with mental health issues, because the society does not really give them just. So yeah, that's why I'm here. Thank you.
Thank you, Lucy. Carol, we'll close with your introduction, last but not least. We're sharing out our motivation for studying your master's in clinical or counseling psychology. And yeah, you could share what your research area is. Carol Sirangara?
Yes, I'm Caroline Sirangara Wahungu, and I'm taking counseling psychology. My motivation was to help people in their relationships, and I was interested of looking at women empowerment and how it affects family, or how it impacts the family. Yeah.
Okay. Thank you. Thank you so much. So Dr. Thomas Obulutsa, we've called him Mwalimu Tom. Welcome. You've had the introductions. And as you introduce yourself, I was looking through your profile and see that you did a BA in philosophy. Then you did counseling psychology. I'm not sure what the PhD is. Is it clinical or counseling? But I'm suspecting it was clinical psychology, but that's just my suspicion. I've known you as a mwalimu. I've known you as a mental health professional, but also as a kind of, if I may, I'm not wrong, kind of in the administration of organizations offering mental health and mental health services. But tell us, as you give us, help take us through today's session, maybe philosophy. What's its place in psychology or even in Kenya as a whole? Welcome, Daktari. Daktari?
Sorry, I was speaking to myself.
Oh.
Thank you, Chris, for the question, and thank you everyone for sharing your motivation. It is my way of trying to understand the group that I am facilitating with. It's part of, so to speak, relationship building with the group. So as Chris has said, my name is Thomas Austin, counseling psychology. So my doctorate was actually in counseling psychology. The university I did my doctorate at, we had the freedom to, quote unquote, design the extent of the doctorate program because it was a distance learning program. We were doing it online before COVID. So the first year, I did some coursework. The second year, I did clinical work. We had to do more than 1,000 client hours for the second year. Then the third year and the fourth year, we were really concentrating on the writing of the doctorate thesis. So over the years, one of the things I have learned, sometimes as you do your studies, your motivation reminds you to keep focus. It reminds you on why you started that journey, so to speak. And the reason I ask that is because if you look at the statistics for students who complete their studies in Kenya, many times we blame institutions, we blame departments, we blame supervisors, but also of late we realize also we also need to blame the students themselves in terms of poor completion rates. You have 100 people starting the course. 2 years later, maybe you find 50 of those 100 are finishing that course. 4 years later, maybe you'll find another 25 have finished, and maybe 25 have dropped off. So you find, like, for example, the students who are doing a master's degree program, there are those who actually take 3 to 4 years to complete a 2-year master's degree course. So of course, that's worrying to many of the policy makers, university administrators. At the doctorate level, you'll find if a PhD program maybe is 3 years, the average nowadays is close to 9 years for one to complete. So you'll find a lot of doctorate graduates, they start to have gray hairs because of these completion rates. So of course, there are a number of tips that we can use to help us finish on time. So I think that is the key message that I may want to pass today. How do we help each other to finish on time? So that's the first thing to consider. So from my own experience, because I was working in a TB hospital at the time I was doing my doctorate. I was working in a TB hospital on the northern part of South Africa, a small town called Piet Retief. But the university I was studying was in Pretoria. So every Friday, Thursday night, I would drive to Johannesburg. Friday, I would go to class or meet my supervisor. Sunday, go back to work. And so there are certain things that I learned over the times. So for example, the first thing that I learned when you have schedule of time, so set specific times for writing. So that was one of the things that I tried to do to help me really succeed. Set specific times for writing. So I would go to work. I would go to work 8 to 5. After that, then I would go to the gym. I would go to the gym. Then after that, now maybe reach my house at around 8, relax a bit. Then 10 o'clock, I would 10 o'clock. Then I would start to do some work. So I would work for 2 hours between 10 o'clock and midnight. Just a minute. So that was the first thing that worked for me, setting specific times. So in your own lifestyle, depending on the obligations that you have, depending on the responsibilities that you have, set some time to do your study. So specific times. So that was the first thing that really worked. The second thing is to set some goals. You're writing your thesis. There is a long-term goal, which really generally is to write and to finish. But then you'll find you need to set some specific goals during writing of the different chapters, collecting data, analyzing data, doing your literature review, such things. So for me, again, having those types of goals really helps. You can have a long-term goal, you can have a specific goal, you can have even a weekly goal. And in this case, of course, you have learned about how to set SMART goals. So you set your own SMART goals. I remember I set a goal for myself that every day I will read 2 journal articles. So that is what I tried. Even if I was having a thought block, sometimes I would have a writer's block, sometimes I would feel discouraged, but I just set some goals for myself. I said, today I'm going to read 2 articles. I may learn something out of those articles. Then the other thing as you write your work is to make a distinction between the writing stage. So you'll find there are times you'll make a plan on how you're going to do your literature review, for example, or you'll make a plan on what you're going to write for your methodology chapter, or you make a plan for how you're going to go about your data analysis or data collection. So you make a plan. So that's the first part, the planning stage. Then you have the writing stage. You write what you have planned to do. Then, of course, you come to the last stage, which is usually the editing stage. So you find, again, some supervisors prefer if you submit chapter by chapter. Others would prefer if you submit section by section. So it depends, again, with the type of relationship you have with your supervisor. So like for myself, I was always submitting chapter by chapter. It had its advantages and disadvantages because at times you find you've completed a whole chapter and the feedback from the supervisor changes the whole trajectory of what I had planned to do. Then, of course, the other thing is to realize that for you to write well, you don't need to be inspired. I know a lot of times we may be looking out for inspiration, but you need to realize that for research, a lot of times it's about the process, it's about the structure. So for example, you'll find you are in traffic, you are thinking about your study, you get an insight, you write it in your notebook. You're going to aerobics, for example, you get an insight, you go to your gym bag, you get your notebook, you write. So I would find myself that sometimes you find the motivation comes from these other everyday things, as opposed to just sitting behind a desk and doing the study. Then one of the things that affects many students is procrastination. I remember one time I was working on a journal article and it took me 2 years to actually complete that article, yet I had everything that I needed to do that article. So procrastination can really affect how you're working. It can cause you anxiety. A lot of times as an individual, you'll get anxious because from time to time you may be like, what am I really doing? What is my motivation for doing this study? Am I going to succeed? After graduating, will it be helpful according to my original motivation? So those things again will affect procrastination. Then of course, the other one is about perfectionism. The interesting thing is your work will never be perfect. Even after graduation, your work will never be perfect. And the reason I say that is because you'll write, your supervisor will review it and give you feedback, and you'll revise it, and you send it back, and maybe you might get another feedback. You still keep on revising it. It may never be perfect. When it goes to the examiners will also review what you have written, and they'll give feedback. And so you'll find the work can, and if you take it to the editors of a journal article, again, they will review what you wrote and give feedback. So you'll find it may never be perfect. So resist this idea of being perfect. Then, of course, the final tip that I would share is what we are doing now, staying connected with others. Writing your thesis or your dissertation is very lonely. It is a lonely journey, if I may use that, because at the end of the day, it is you, your ideas, and your writing. So getting connected with others, sharing ideas with others really, really helps in terms of improving on your writing. So for today, I wanted to suggest that instead of doing a presentation, we review each other's studies. And then based on that review, we can be able to help the person we have reviewed to see how to improve on their study. So I will share my screen, and then I can ask some volunteers to share their topics. Chris, confirm if you can see my screen. Okay.
Yes.
So who wants to be the first person on the chopping board? Anyone doing a quantitative study?
Abel.
Abel, you have been volunteered. Don't worry, it will help all of us to learn from you.
Oh, okay, thank you. When I was asked to introduce myself, I mean, when we started introducing, I think I was among the first.
Yes.
And so I did not say what my area of interest in research at the moment.
Yes.
I have defended my proposal, I think it must be 2 months ago, and then just what you've just said, procrastination. Since then, the corrections were very few, and I have found myself not doing them until Chris disturbed me the other day. Was it yesterday, Chris? Since you defended, we want to see a conceptual framework, and I said, gosh, I forgot about the whole thing. So my area of interest in counseling psychology is actually in marriage and family. And I had a desire to do a research on one thing. My casual reading of the area of preparation for marriage was showing that about 90% of marriages are contracted through churches, not so much government as churches, because there is mutual assistance between the government and the church when it comes to marriage. And yet, the rate of marital breakage of those celebrated in churches and those celebrated by the civil authorities is almost the same. The difference is negligible. And so we are wondering, what does the church do? What kind of content is the church giving to those couples, and how does that affect their marital satisfaction later in marriage, or when they contract, after they contract their marriages? So that is my area. Again, you can tell that that is motivated by the work I do as a priest. It is, and not just a priest of a church that makes a big noise about the sanctity of marriage and, you know, sacredness of the marital bond and indissolubility of marriage. And then to see one marriage dissolve or break down totally irretrievably makes me ask, what happened at the preparation for that marriage. So that is my of questioning research. So I wrote my proposal under the title of, do I even remember the title? Gosh. Let me Chris, you're the one who
I'm laughing with you. I'm laughing with you. Not
you better laugh. You better laugh, and after you laugh, you tell me that I should wake up and do something. So yeah, let me just be precise with my topic, because I think from there on the rest make sense, including my conceptual framework. So my area of research, or my topic, is I'm opening. No, not this. This was after correction. In a moment. Yes. No, I'm opening the same thing. Sorry, I should have opened this even before Chris.
No worries. No worries.
Okay. Okay, I got it.
You are ready?
Sorry, what happened is that it is in a different laptop. I'm sorry, but it is influence of premarital education content on marital satisfaction of church-wedded couples in selected parishes of the Central Deanery, Nairobi County.
Let's repeat: influence of premarital education content
on marital satisfaction of church-wedded couples.
Satisfaction of
church-wedded couples.
Wedded couples.
In select parishes of the Central Deanery.
Central Deanery.
Nairobi County.
Nairobi County.
Yes.
Okay, so that is the title, yeah?
That's the title.
Thank you very much. So looking at this title, what are your variables?
My variables are premarital education content as the independent variable, and marital satisfaction as the dependent variable.
Okay, marital
satisfaction is the dependent variable.
Satisfaction, okay.
Yes.
An independent variable.
It is
premarital content.
Premarital education content, which in literature is falling into two categories. The way I saw in review of literature, there is, in the church context, there is a content that is typically religious, so to say, and the content that is not religious, but yet it is offered to couples within the context of the church. For example, when we talk about finances, really that is not typically from religious background. But when you talk about prayer in the family, then that is religious language, the content of how the family can pray in order to remain together and enjoy more satisfaction in their marriages. So I could tell from literature that the content being offered in churches can fall into those two subcategories. And so the independent variable is broken into those two subcategories, if I may call them so: non-religious premarital education content and religious premarital education content.
Okay, thank you. So in terms of the people you are interviewing,
yes,
what would you want to know about them?
I would want to know
in terms of their background variables.
Our background variables that
Yes.
I am asking them about their gender.
Yes.
Their age.
Yes.
Their level of education.
Yes.
And the duration of the program. How long were they exposed to the program for preparation for marriage?
Marital education
program. Duration.
Okay.
Yes.
Thank you. Don't need to know about the employment status, no.
I didn't feel like that was determinant as such.
Okay.
Yeah,
okay.
but the level of education, yes, because it can also kind of moderate how they consume the content or interpret it, in my view.
Okay, thank you. Then we go to the control variable. From the title, what are you controlling for? If someone was to look at your title.
I'm controlling for the duration of marriage.
Okay.
I don't know whether I'm getting you right.
So I'm going to interview people, okay?
Yes, okay.
These people I'm interviewing, where are they coming from? They must come from these parishes, correct?
Exactly, yes.
Is it resident of those parishes or worshippers of those parishes?
It is residents within those parishes because they fall in a certain geographical area. That is the central deanery within the metropolitan city of Nairobi.
Okay,
and then again, only those who are wedded in church, which means they went through a certain period of preparation for that marriage. So those who are not wedded in church are not included in my study, are not part of the study.
Thank you. Meaning now, if you are going to collect data from the people, you will not interview a Muslim.
Exactly.
You will not interview someone who's coming from Murang'a County.
Exactly.
Yes, yes, okay. So, when you do your literature review,
yes,
did you find any information about the relationship between age and marital satisfaction?
Yes, I did.
Okay. What about gender and marital satisfaction?
Yes, I did.
Education level?
I did.
Okay. Then duration of the marital education program with the marital satisfaction?
Yes, in the context of my theoretical approach or theoretical framework,
yes,
which is social constructionism theory,
yes.
The longer they are exposed to those programs and that content given in those programs, the more they are able to make sense and construct how a marriage is, what are the roles that genders play, because they are also socially constructed.
Yes.
And then that tends to also affect how they perceive their marriage. They construct their marriage as satisfying or not satisfying. From that approach, yes.
Did you find literature specific to that relationship?
Between duration of the program and marital satisfaction?
Exactly, yes.
Okay, it was not specifically that way, but in the literature I reviewed, I could find some of the researchers who indicated that the duration of a program affects how couples, not only affects, but moderates the relationship. I would just put it that way. It's not really direct effect, but it's through moderation of the relationship of other variables.
Okay, thank you for that. So now we come to, again, we come to your literature review. When you did your literature review, did you see any relationship between age and premarital education content?
Not really mentioned directly.
Yeah,
not mentioned directly.
Okay, so the reason I'm asking you this is because first you're going to collect this information from the people you're interviewing, your sample.
Yes.
And then eventually you are going to write your discussion chapter.
Yeah.
So as you write your discussion chapter, what is going to happen is that you will state your results. So of course, through your methodology classes, you've learned about the APA methodology or the APA style of writing. So
yes.
you will state your results. Then now you have to relate your results with what is in literature again. So it's like you're repeating your literature review, but with information from your study.
From my own data, yes.
Yes. So for example, if I did a study and I found there is a correlation between age and marital satisfaction, and then in your study, you have done your analysis and you realize that the people of the central deanery, there is no correlation between age and marital satisfaction.
Yes.
You understand?
I am getting you. Thank you.
Yeah. Yes. So for me, normally I like to do this type of exercise because if you do this, if this diagram is clear for you, everything else is supposed to fall in place. Your literature review is on this. Your problem statement will be on this. Your developing of your questionnaire, still you go back to this diagram. Your discussion chapter, you still go back to this diagram. So every stage is based on this. So now I have a question. What type of measuring instrument are you going to use to measure premarital education content?
Gathering from literature, which are the topics commonly given in these programs, the first tool to collect demographic variables, of course, is my researcher-designed tool. Then, for the religious and non-religious premarital education content, and even the provider of the premarital education content, I'm also designing that tool from the items I've picked in literature. But the tool for measuring the dependent variable marital satisfaction, I will use Kansas marital satisfaction scale, which is a validated tool and has also been used in a few studies within the context of Kenya and even one study in Nairobi setting.
Okay. So for me, when I looked at this, I asked myself, are you going to give, I'm imagining I am the person you're interviewing, eh?
Yes.
And you're going to interview me on the premarital education content.
Yes.
The religious content and the non-religious content, yeah?
Yes.
So maybe you will ask me questions on how to deal with conflict. Did I learn that? How to manage finances? Did I learn that?
Yes.
How to set boundaries in the relationship? How to be an effective parent? Or how to deal with infertility in marriage and all these kinds of things that we normally do in premarital education. Eh?
Yes.
So if that is clear for you, I think we can give you a pat on the back.
Thank you.
Are there any challenges you are facing as you are doing this study now, apart from procrastination?
Per se, really no, because the only thing I had misfired even in the proposal was to align the tool really to capture the objectives as stated here. I don't know, Chris, whether it is possible for me to share my screen. I think it would help.
Yes, yes, go ahead.
Just to share my conceptual framework as it is, because
And
what Daktari has helped me, has asked me, is very, very mind-opening. I would love if you saw it, and then you can assist me to just critique it the way it is.
Thank you. And then the next volunteer can be preparing this. Abel, go ahead and share your screen.
As Abel shares, thank you, Patricia, for your willingness to share your conceptual framework.
Sorry, not sure whether it is sharing already.
It's coming.
It seems to be stuck somewhere. No, let me stop share and then I share again. Yes, I don't know whether you can see.
It's not yet.
Sorry, let me close some of these windows that are preventing me. Sorry, I'm sorry. I first close because it's showing cycle of windows. Okay, now I share. Visible now?
Yes, we can now see it.
Yes, yes. Now, Daktari, when you were asking me about the aspects of age and marital satisfaction, in reviewing literature, I didn't find it very, very prominent in the relationship between premarital education content and marital satisfaction. But gender and duration of the program was coming as a very strong modulator or moderator of that relationship. So I don't know, it is flickering on my end. I hope you can consistently see what is on the screen.
Yes, we can actually see it, yeah? Thank you for sharing.
Okay, now I think it should be okay.
It's clear for us. It's clear for us. So I'm looking at your independent variables.
Yes.
And I'm now imagining I am the person who is being interviewed.
Yes.
What kind of questions or questionnaire am I going to respond to?
Okay, so you're going to respond to a questionnaire that has 4 parts. Part 1, I'm sorry, it is just shaking in on my side. So part 1 will be questionnaire that gathers some information about the demographics of the person I'm going to interview. And as I said, I was debating whether even I need to collect information about people's age and level of education, because per se in this relationship, I am not finding in literature any much mention when it comes to premarital education content and programs and marital satisfaction, but gender and duration of the program were prominent. So that's why
Thank you for that. So I think one of the things that may happen is that as you review literature, you may not find the relationship between your background variables concurrent with independent and dependent variables at the same time. And the reason for that is because maybe you haven't found studies that are studying these variables in the same study. I don't know if you understand, yeah?
I'm getting you, yes.
So you'll find there could be relationship between the background variables and the dependent variable, or the background variables and the independent variable.
Yes.
Okay. And so maybe that is what now will give your study some significance, because now you're going to match these variables together to really solve a problem that you saw.
Okay, I understood. Thank you.
You understand, yeah?
Yes, I get you, Dr.
Okay, so now the next question, I know you have already put your theory as a social constructionism theory, yeah?
Yes.
As a religious person, do we have any theories on premarital education?
No, from the religious point of view, no, they are not theories.
Okay, is it to the best of your knowledge or in actual fact?
From all the articles I scanned, Dr. There is no study done that I came across that uses a theory that is stated to be from religious background.
Okay, and I don't know if we have any teachers in this group or anyone with an education background. So maybe I'll give you homework, theories of education, and then extrapolate those to theories of premarital education. Food for thought.
Okay, I'm taking note.
Food for thought, because again, this information again will help you to enhance your literature review. It will also help you to enhance your discussion chapter. Yeah.
Yeah.
I know about the issue about age. You are a priest. You have maybe participated in the wedding ceremonies of a young couple, maybe 24 years.
Yes.
And you meet another couple, 35 years. Maybe the lady is 35 and the man is 38.
Yes.
If you look at these two groups of people, the ones in their 20s and the one in their 30s, in your own estimation, how do they perceive this premarital education? That's the first question. And the second thing, how do you anticipate their marital satisfaction is going to be like?
That is a very significant question, Dr. because really I have observed in preparing them myself, although it was not in the view of my study, but doing it because it was my occupation and duty as in charge of the church. Yeah, the younger ones tend to focus more on how the wedding will happen. But those who are already into marriage, they don't care about the wedding day so much as understanding the dynamics of their relationship from the context of the content they are being given during those programs. So yeah, the two approach the education program differently in terms of the concerns.
So in a sense, you'll notice that there are age differences.
Yeah, there are age differences in the way they consume the content, or even the way they interpret it, the way they understand it. There is age difference in that, yeah.
Okay, thank you. So thank you for sharing this. I think the rest of the group are learning something from you. I don't know if there are any questions from the group concerning this specific study.
Maybe I can share. I mean,
yes, go ahead.
About age and I think marital satisfaction. I don't know whether it relates, but also when two partners come together with also different in age, I've seen an issue of lack of respect, where the other sees the other like a child. I listen to some couple like interacting in that manner, and the other is not even does not have a problem to say that even in public. Like, this is just, you know, you are still young, or even making fun of how one is older than the other. So I think it can also affect the esteem of one partner, and probably even affect, I don't know whether it can later affect their satisfaction, but I've listened and I was like, wow, okay. Yeah. So I don't know, probably there is something to do with also age and satisfaction.
Thank you for that. Yeah, I think Abel, you'll notice that in your literature review.
Yes, I will. Yes. I will. Especially with the dependent variable, there is enough of literature in that effect. But with the independent variable, I will have to scan literature with a third eye.
Yes, and maybe widen your search.
Yes.
Your literature search, yeah.
Yes.
Yes.
Thank you.
All right.
Thank you.
Thank
you,
Abel.
And thank you, colleagues.
Thank you, Abel. So next time, maybe we'll hear from you the measuring instrument or even the data that you've collected.
Asante.
Thank you so much. We can now go to Patricia. Was it Patricia? Chris?
Well, that was me who volunteered, but if Tabitha Wamushie is willing to share her conceptual framework, and also just to mention that Tabitha is defending her proposal tomorrow morning.
All right. So, yeah, so we are doing a mock.
So Patricia, can we put you second?
All right. Tabitha, what is the title of your study?
Tabitha?
Sorry, I'm still working on my presentation. The title of my study is, let me check on my presentation so that if I make, is factors contributing to prenatal stress among pregnant women in antenatal clinic in Nairobi County.
Okay, factors contributing to prenatal stress.
Prenatal stress among pregnant women in antenatal clinics in Nairobi County.
Antenatal clinics. Antenatal clinics in Nairobi County.
Yeah.
Okay. All right. So this is the title. What are the variables of your study?
I have independent variables. The ones that I have as the independent variables is unplanned pregnancy. There is intimate partner violence. I write it as IPV, intimate partner violence. There is lack of social support.
Also as another variable.
Yeah, another variable, lack of social support. And the last one is stressful life event.
Okay. Then for the dependent variable?
Dependent variable is the level of stress.
Okay.
And then I have another variable that is intervening variables.
Intervening variable, what about it? Yes.
My intervening variables are the maternal age,
maternal age,
also work status.
Work status.
There is parity.
So repeat again.
Parity, parity.
Okay, yes.
Parity, parity.
Mm-hmm.
And then there is marital status.
Okay. All right. Go to the background variable. What would you want to know on the people you're interviewing?
Oh, what I want to know if I want to know the factors, the things that are making them to be stressed.
Oh, for the individual themselves, eh? Like you want to know their age, their gender, in terms of their background.
Yes, yes, I want to know their age.
Yes.
Their gender.
Yes.
Their parity.
Okay.
Parity.
So is this, yes.
Yes. And marital status.
Okay.
And also their education background.
Educational background, yeah?
Yes.
Okay. Right. So if I may ask now, looking at the variables that you have mentioned here, if someone looks at your title, will they be able to pick those variables?
Yeah, like now the factors, like the factors that I've gotten factors in my literature review, and the factors that I've gotten is now the unplanned pregnancy, intimate partner violence, and lack of social support and stressful life events. Those are the factors that I've gotten. They are the cause of, they are the factors that contribute to prenatal stress. I've gotten in literatures.
Okay. I don't know if anyone is understanding what I'm asking.
Okay.
Chris? Chris, if you look at the title,
yes,
and you look at the variables that have been mentioned,
yes,
does the title reflect those variables in your own view?
Yes, because of the word factors.
Because of the word factors.
Yes, I mean factors are, yeah, because yes, for me it does generally rather than maybe specifically.
Rather than specifically. Okay, thank you. Who else wants to try in terms of giving the opinion? Remember, we are doing a mock presentation for her, and she's going to be asked the same questions tomorrow.
Dr. If I may contribute to the question you've raised.
Yes, Abel, go ahead.
From the title, I feel that the dependent variable is prenatal stress.
Okay.
Yeah. Now, the factors that are not mentioned, they are unknown. I believe that the author is finding them from literature. Like that life stressful life events of pregnant women contributes to prenatal stress. Like that. I think the factors that form the independent variables can only come from literature in this case. I'm not sure that I'm answering even the question that you've raised. Sorry for fumbling.
No, you're doing well. This is the question that you're going to be asked tomorrow. This is one of those questions, yeah? Because the person reading, if they just see your title without reading your abstract, without reading your chapter 1, the individual should be able to say, okay, I think I know what problem is being studied. Milka, I don't know if you want to contribute. Go ahead.
Thank you, sir. I wanted to say it doesn't seem very clear looking at what is put in these places of independent and dependent variables. And I would agree with Abel to say, I think the independent variable, no, the dependent variable is the prenatal stress. So maybe she's right when she says levels, but it should include that term prenatal stress levels maybe. And then when it comes to independent, the factors, maybe they need to be a little clearer, either from the variables or from the title itself, as in what are these factors, because I don't know which background she's coming from, but when coming from a psychological point of view, rather psychology point of view, maybe you are talking of factors that could be either psychological factors or is it fine? Whatever factors that they are, because it could range physical factors, even when you think of pregnancy, maybe biological factors, then it is good to understand what are these factors we are talking about. So it doesn't seem a bit clear. I mean, it's not very obvious. Thank you.
Thank you. Someone else? If you are to edit that title, how would you edit it? Knowing that these are the variables that our colleague wants to study.
I think maybe psychosocial factors to be so that they can be specific.
Okay, like for me, when I looked at this, I'm looking at the pregnant woman is the control variable. So meaning that the people who you are going to interview, one of the conditions is that they must be pregnant. Eh?
Yes.
That's correct?
Yes, yes.
They must be pregnant. Eh? Regardless of the stage of the pregnancy.
Yeah, sorry?
You'll interview anyone, whether it's the first trimester, the second trimester, so long as they are pregnant.
No, I would like to see that they have interacted with the pregnancy, because I'm assessing prenatal stress in pregnancy when they are interacting with the pregnancy. So I don't want the first, it's above 20 weeks and above.
So must be pregnant above 20 weeks,
20 weeks and above.
Okay, above 20 weeks. Second one is that they must be resident in Nairobi. Is that correct?
Yes.
Okay. So now, you mentioned something about intimate partner violence.
Yes.
I'm thinking this can be an independent variable on its own. You also talked about unplanned pregnancy. How do you measure unplanned pregnancy?
It's subjective, is according to the way the mother will say, did you plan for the pregnancy?
Yes, yes.
It's subjective, what the mother will say. It's not measured with an instrumental what.
Okay,
it's just
then
subjective.
Social support, how do you measure that?
Even in the social support, I didn't get an instrument to measure the social support. I've decided it to be also subjective, because my problem is if I have these tools to measure social support and also to measure the level of stress, which has so many questions, and I'm dealing with a pregnant mother who will answer all those questions, and I get a questionnaire with 20 30 or something, it will be so tiresome to the mother. So I've decided to formulate a questionnaire that will make me know if they are socially supported or not. It's the way they will say if they are supported.
Okay. What challenges are you going to face with that approach?
Yeah, maybe honesty.
Before even the person responds to the questionnaire, what challenges would you anticipate?
Maybe the asking of the question.
The asking of the questions. Anyone in the group? I heard we have some clinical psychologists in the group. What challenge will she face? You know, when we talk about the design of tests and scales, testing for reliability, validity. I don't know if anyone wants to comment on that. Chris, help me here. You can call out someone to respond.
Okay, when I hear, that's Peter speaking. When I hear about reliability and validity, then what comes to my mind is the tools, the type of tools that are going to be used.
Exactly,
and that's why we consider tools that are already validated, or tools that we know of their reliability and their validity. But when I look at the theoretical framework in front of me, then I'm thinking of the tools, the psychological tools that might be used. Then I think it gets now that's where the challenge comes. Thank you.
Okay.
Okay.
So I don't know what your response would be.
My response is that I've seen psychological tools that may assess social support, and some of these psychological tools has more than maybe 20 responses. And I was thinking about now, and then I'm also using a validated psychological tool to assess the level of stress, which has 10 responses.
Yes.
So 20 plus 10 now plus my formulated Nini, it will be bulky. So I thought I can reduce it to something friendly to a pregnant mother who has come for clinic to finish very fast and go. So I think I was thinking about maybe if it's social, is formulated, is research formulated questionnaire, maybe the validity and reliability will be assessed by maybe when we sit down and discuss about the questionnaire, and then we see how, if it will answer what is expected to answer. That is what I thought I would do.
Okay. Thank you for that. So in terms of your title, I'm wondering if you are able to reflect on revising it.
Okay.
So that it reflects the variables that you are studying.
Okay, like how maybe?
Because like now, one of the variables that you can actually confirm is in the title is prenatal stress, yeah?
Yeah, that is a dependent variable.
Yes, that one is clear. One can already know that is the variable you're studying. Yeah?
Okay.
Factors contributing. I don't know if you're able to break this into these variables that we've put inside.
Okay, so I put all the variables, that is factors contributing are these, and then I don't know.
Meaning that if you are to revise the title, the reader will get the factors in the conclusion as opposed to get the factors in the title. I don't know if anyone else is getting my train of thought.
Okay, maybe give me an example of how maybe I can.
So like, for example, you have talked about intimate partner violence. is one factor, yeah?
Yeah.
So for me, I would say instead of talking about factors contributing to stress among pregnant women, maybe I would look at social support, intimate partner violence, and prenatal stress among pregnant women.
Okay.
You're getting my train of thought, eh?
Yes. Oh,
so that now my study is specific, that my 3 variables are social support, intimate partner violence, and prenatal stress.
Okay.
I don't know if anyone is getting my train of thought.
Yes,
okay.
Daktari, I'm getting what you're saying. I think it makes it even more clearer.
Yes.
Yes.
And concise.
I just want to ask whether, Tabitha, whether your study is purely quantitative or your mixed method.
It's purely quantitative.
Okay, so then I think what Daktari is proposing is very helpful, because then in making a Likert scale questionnaire, it helps to have those separated that way.
Okay. Oh. Okay, I will. I'll hear about it. Yes.
Tusikwe tumekuchanganya.
Sijachanganyika, but I will consider that and see. Because now in my changing right now, it might not be easy, because I have now my independent variable I've said is unplanned pregnancy, intimate partner violence, lack of social support, and stressful life event. Will I put them in all of them in my
in your title? In your title. So maybe we can give you an assignment as you prepare for tomorrow. I don't know if you're able to access psych articles. Just go to psych articles and look at either the current issue of the American Psychologist or the Journal of Counseling Psychology, and look at how the titles are presented.
Okay.
Look at how the titles are presented. You'll notice in a lot of journals, we do not have factors as part of a title.
Okay.
You do not have factors as part of a title. Eh? So for example, if I was to refresh your title, let me try and refresh it and then you see. I will say social support and intimate partner violence as predictors of prenatal stress among pregnant women in Nairobi. So this is what I would, this is, for example, for me, what I would now look at as a study. Yeah? You're doing a quantitative study. So one of the variables you'll measure is social support, for example. The other variable you'll measure is intimate partner violence. Then unplanned pregnancy, I will not consider it as an independent variable. What I would have done, I would put it as a control variable, that as I'm interviewing these women who are 20 weeks and above pregnant, I will also want to hear from them if the pregnancy was unplanned. So if the pregnancy was planned, then they are out of my study. If I heard you right, yeah?
Okay.
So meaning that the people who are being stressed are the ones whose pregnancy is unplanned.
No, according to the literatures that I've read about and the literature review that I have,
yes,
I have some studies that they are talking about comparing. It's a comparison thing, that is, people who had unplanned pregnancy had this level of stress, and people who planned pregnancy has this level of stress. So
okay, yes.
Yeah.
Okay.
Yeah.
I see a chat comment in the chat box. Milka has given you another title that you can also consider.
Okay.
Yeah.
Dr. But I know that the fact that she's presenting tomorrow, she needs to be careful with our suggestions, so that because she may not change much, but she can put them down maybe for her responses in case she's questioned in the same manner that we are questioning, or that she can consider them later.
Exactly. So I think the key message that we are passing to her is that the title that she has presented, someone might ask to see whether the variables are coming out. Yeah.
Okay.
Yeah. So that's the key message that we're giving to you, that yes, you have your title. You have most probably already discussed with your supervisor, and you have agreed that that is the title, the working title, so to speak. Yeah.
Yes, because it has been changed severally.
Exactly. Yes. So also anticipate that other examiners might want, like for example, for me, I might want to have a concise title, so that instead of me getting factors, in my own expectation, I may want something that is concise to that level. Yeah. So that's just one of the ways to anticipate the types of questions that will be asked. Okay. Yeah, we are not disputing the whole title. We're just saying that in case there is room for editing, how would you edit it?
Okay.
Yeah. Then I think the other thing, that as you do your literature review, did you notice any literature on age versus social support, for example?
What I did then?
Yes.
My third objective is comparing the demographic data.
Yes.
With prenatal stress, preference of prenatal stress. So now,
meaning you'll be comparing age differences, gender differences,
no,
marital state.
Gender.
Yes.
Pregnant women, no gender.
Okay, amongst these pregnant women, for example, if you look at, like these days when you talk about sexuality and sexual orientation and how people perceive themselves, just food for thought. I see Peter has raised his hand. Go ahead.
Thank you very much. Sorry, I've been following that, and I wanted to make a comment on the topic. And I thought like we say, this is a working topic, but I think in one of these trainings or courses that we had, we were told that your topic could change. In fact, many people, the topic they start with their proposal is different from the topic they will do their defense on. So I believe even for Tammy, there's room for change of the topic as you move into the research. That was my contribution. I wanted to confirm if that's also your position, Dr.
Indeed, that is correct. That is correct. Topics do change, especially after you have done your literature review, because at the beginning you think that this is the problem I want to study, and then you do your literature review, you do your methodology, and then you realize, oops, this topic actually needs to change. Like, for example, maybe you set out at the beginning to do a quantitative study, but as you do your literature review and as you do your methodology, you realize that this study can actually be a mixed methods study, where I will have both qualitative and quantitative, and that already has an influence on the title, on your topic, on the title that you've chosen for yourself. So as you've already rightfully attested, you have changed this topic before.
Severally.
Severally, yes?
Yes, it has been changed every now and then. It's changed. So I'm open. In this thesis, I've decided to be open-minded. Anything can happen.
Anything can happen, yeah. So I think for me, I think the only concern I had was that as I read the topic the first time, I could not pick the specific variables that you are studying just from the title, because it was factors contributing. So for me, I was like, okay, are these economic factors? Are they social factors? Are they medical factors? Are they geopolitical factors? Because all these things can contribute to prenatal stress, you know. Cost of living can be a factor, all this.
Yes.
So for me, when I looked at that first phrasing, I was actually concerned that it wasn't precise for me.
Okay.
Yeah, that was my interpretation.
Yeah. I now understand completely.
Oh, okay. So then for your literature review, so you've looked at the background variables in relation to this in relation to
the
this
background variable in relation to the preference of stress. That is the level of stress.
Okay. In terms of the background variables in relation to the independent variables, I don't know if you have done that also.
Yes. No,
so for example,
no, that one I've not done. But in my literature review, in almost all,
yes,
that is for marital status, for like unplanned pregnancy.
yes.
In each study, I was checking at the age of the person who was doing the age of participants. I was recording the age of participant, even if I never did the comparison between now the maybe intimate partner violence and the age. I haven't done that.
Okay. So maybe that's something you might want to look at, yeah? How does age influence unplanned pregnancy? For example, if a 49-year-old, I know when I was working in a clinic, I once had a client who was 49 years old and was pregnant. And it was drama in the clinic because she wanted us to remove the pregnancy. So age versus unplanned pregnancy, a young person, an older person, gender versus intimate partner violence, education level versus intimate partner violence, parity versus intimate partner violence. Are there any literatures that are available in that regard? Yeah.
Okay.
And then also once you've collected your data, again, you'll do the same kind of exercise that my study, this is what it shows. How does it relate to other reported studies?
Okay.
Yeah. All right. So I think you have some points to reflect on.
Can I interrupt you, please?
Yes, go ahead.
So in the literature review, in essence, it's supposed to be like you do literature review on the background variables and the dependent variables. Then you do literature review on the independent, the relationship, the connection between independent and dependent. From what you're saying, because like your first, she needs to look for literature comparing age and lack of social support, then age and intimate partner violence, and then so for the rest of the then again she goes on to look for literature on the independent variables and the correlation between independent variables and dependent variables. Is that what you're saying?
So that in my own view, that is how I go about it, yeah? In the sense that I'm asking myself, why am I doing a literature review? I'm doing the literature review to understand, are there studies that have been carried out in this topic, generally, so to speak, yeah? Intimate partner violence, stressful life events, social support, generally, are there studies that have been carried out? Then I might ask myself, what are some of the controversies that are out there? What are some of the emerging issues in relation to that topic? Then I might now decide to be more specific. Are there studies that have been carried out in Nairobi, for instance, or in Kenya, or even in Africa? So you'll find as I continue reviewing the literature, I'm already narrowing down literature that is available that is almost specific to the focus of my study. Now, because I'm going to collect background variables, and this is mainly when it comes to quantitative studies, you might want to also find out if your background variables have been studied in relation to your independent variables. So you might find, for example, someone might have done a correlation study or correlation analysis between the different ages and your variable. So you find, is there a correlation between age and unplanned pregnancy? Or is there a correlation between marital status and levels of prenatal stress? Maybe a single mother or someone who's not married and they are pregnant, and the father of the child is not in the picture, might have more stress compared to a woman who is happily married with a supportive husband. So you find maybe are there those kinds of studies. So yeah, for me, when I'm doing the literature, yes.
For maternal age and marital status, I've compared, but still, when you compare, you still hit on certain things like age and preference. The preference of prenatal state, I've written, pregnant mother who were born 20 years had a higher preference of prenatal stress than those who were born 35 and who are 35 and above. That is a study which was done. This was consistent with a study done in by this, which shows that younger age was directly associated with prenatal stress. That one is now comparing prenatal stress and then that is the way I compared. I compared now the prenatal stress and age.
That's quite significant, yeah. Now imagine you have gone to collect the data, and then as you're doing your analysis, you find that in Nairobi, older women are the ones with stress compared to younger women.
Yeah.
You see the significance of doing this literature review. You might say, according to my study, this is what I found. However, reported literature demonstrates that this is how it is, yeah? Yes, yes. So I don't know if that helps. I don't know if that helps you as you ask. Linda, go ahead.
It helps, but I'm wondering for this study, because we are just looking at females, yeah? So is gender more of a control variable here because we are eliminating the males? Eh?
For me, I'm not.
Are you getting? I'm just wondering, as a control variable, would gender apply so that we eliminate the male species?
Okay, it was me who put gender there to kind of challenge the person doing the study, yeah? In the sense that these days when people talk about types of gender,
yeah.
You understand? There are people, for example, if you have a pregnant lady who decides that they identify themselves as non-binary, for example.
Yes.
Or someone who says, yes, they are pregnant, but they define themselves as gender neutral.
Okay.
You understand? So meaning for me, I'm putting it out there to the researcher so that she can, even if it's not part of her study, but it can also be part of a literature review, so to speak, yeah? That we have different gender identities out there, and that in my study, in as much as I was looking at women, so someone whose chromosomes are of that make them a woman, okay? Biologically, the chromosome make this person a woman, so that is what you are interested in. However, you might find that in as much as my chromosomes define me biologically, socially, how am I identifying myself in terms of gender?
Okay. Oh,
you understand?
Yes.
Yes, so it's just to throw a spanner in your, as you do your literature review, to think about all this that come. Eh? Yes. Linda, I hope that is clear.
Yes, it is. Thank you, Dr.
Yes. All right. So I don't know if you feel prepared for tomorrow's presentation, Tabitha.
I'm preparing myself here, conversing with my supervisors as I prepare.
Yes.
And I was preparing my presentation as we discussed with her.
Yes.
So that maybe I can be able to to defend what I have, and maybe make this to what I'm so open to any change, because I've really changed these things. I'm like, anything can come. I'm so open-minded. I don't want to be fixated on things that I don't want to change this. I don't want to change this. I want just to have an open mind that things can change to make it better. You know, changes will make it better. Yeah.
Thank you so much.
Yes, and these background variables in my literature review, in my conceptual framework, I've called them intervening variables.
Okay.
Yeah, because I felt like that they are intervening, they can change the levels of stress depending on where the mother is. If a mother has an unplanned pregnancy and is 20 years old, it can affect the level of, the way you were saying, you can compare now the intervening and the independent variable. So that I called it intervening variables, because they can affect the level of stress in between now the unplanned pregnancy and the independent variable.
Okay, thank you so much. I hope it has been beneficial to you.
Yeah, it has really helped me. And then also, if I'm told to add words on my thesis, I have a way of looking at it to make sure I have more words, because if I do that literature review, I will have more words. Yes.
Yeah. So the exercise that I just said, if you just look at the table of content of the journals and see how the titles are being phrased, yeah.
Okay.
Yeah, a lot of journals these days don't like to see factors contributing, you know, because they imagine that the person who reads that study should be able to pick those factors specific from the study. Yeah.
Okay.
All right.
Okay. Thank you very much.
Thank you so much, and we wish you the best tomorrow as you defend.
Okay, I really need that.
Thank you. Chris, I'm looking at the clock now. I don't know if we are to stop or if we do one more.
Personally ready to do one more. Okay.
Yeah, go with the one voice. I don't. And then since we're recording, I'll still share this the recording on the group. But yes, let's do one more, because even Patricia was had a question, and she's willing to share her conceptual framework based on that question.
I think we can allow her. Go ahead, Patricia.
Hi, Dr. Hi, everyone. Hopefully you can hear me. I'm sitting in my mother's bedroom. I'm 40 in my mother's bedroom. It's a bit embarrassing. Anyway, my title. An assessment.
Allow me to laugh first.
So you have to. This
continue.
is one of those things. I think this thesis is designed to teach me humility.
All right. So your title?
An assessment of the prevalence of burnout syndrome.
An assessment
of the prevalence of burnout syndrome. I can post it if you want. That's faster.
Just post it on the chat box then.
What else? Okay.
Burnout.
Yeah, on the laptop, so it'll be faster.
An assessment of the prevalence of burnout syndrome, yes.
And anyone who knows my supervisor, don't report that I'm here. Okay. An assessment of prevalence of burnout syndrome and its general health effects among non-academic staff.
And its general health
effects
among
non-academic staff.
Academic staff, yes.
At Daystar University. What else do you need?
At Daystar.
Yeah.
Okay. You are very specific to Daystar, not just at a private university.
Not just anywhere, Daystar.
Daystar University, okay. Right, so what are the background variables of your study?
So I got conceptual framework.
Yes.
Okay.
Are you measuring age? Do you want to know the age of the respondents?
So my independent variable, of course, is burnout syndrome with its 3 components. So I've put that on. I don't know how to do a picture on this thing.
No, it's okay. I'm picking you. Burnout syndrome, yeah?
So the burnout syndrome, it has 3 components, which I've put on the group.
So you are using the Maslach.
So I'm using Maslach.
Okay.
My dependent variable is the general health survey, which I've put on the group.
Just a minute. I see your study.
No. Okay, so I should first confess here. I've passed through the first proposal stage.
It's okay.
So
it's okay.
Chapter 5.
Okay. Yeah, it's okay. We are in different stages, so that's important.
Okay. No, it's important for me to say that, and I've been here forever. So please unstuck me. Please unstuck me is a request here now.
We will get out of the stuckness, yeah?
So Chris, I've sent you the framework on WhatsApp.
Oh, all right. General health. Oops, sorry. General health.
Yeah.
I copy.
So the general health questionnaire, what do they call it now? Okay.
Okay, then the dependent variable is the social demographic.
No, independent is the burnout. General health is the dependent. And then the social demographics are the intervening ones.
Okay. Sorry.
Does that make sense?
It makes sense, yes. Oops.
It did to me for a while.
Okay, I'm just typing them.
Yeah.
All right. So you're measuring gender.
So gender, age. Oh, it says family, but that's marital status.
Marital status, yeah.
Religion, level of education, and delete department. Department is no longer there. I've killed it with time.
I thought religion would, for Daystar, then it's Christian.
Oh, there was, I think, a few Muslims that showed up on my data, but there was religion, The reason religion came in was because the question was asked at proposal stage.
Yes.
On why I would assume a Christian university has burnout. And so I think I bluffed and put religion in. Yeah.
Okay.
There's
General
no clever
health.
reason for it. Yeah. Then level of education.
Level of
I think
education.
the other one we added was level work experience instead of department. Huh?
Like how many years the person has worked, yeah?
Yeah, how long the person has worked. So I've kind of sent what I had drafted to Chris in a photo form. I don't know if you can get that.
Duration of work or career.
Yeah, the how long your career has been.
Okay, cool. Then were there any specific controls? The first one is that they must be working at Daystar, yeah?
Yeah, first it had to be Daystar. And
permanently or part-time?
No, you could not be an intern or on contract.
Okay, so must be working at Daystar full-time, yeah?
Yeah, full-time and not on contract.
Okay. Permanent, yeah?
Okay. Yeah.
All right, so this is the study, assessment of prevalence, an assessment of the prevalence of burnout syndrome and its general life effects among. So you only had two variables, so to speak, in your study.
Yes.
Okay.
Oh, but that one in the center has caused me the biggest grief.
Which one?
The social demographics. So I've posted what the purpose and the objectives look like when I started.
Okay, so you wanted to determine the prevalence of burnout syndrome among non-academic staff. You wanted to examine the relationship between burnout and social demographic characteristics. You wanted to analyze the relationship between burnout, yes. So your study is quantitative.
Absolutely.
Yes?
Yes, yes.
It's quantitative, okay. So you have used the Maslow's burnout inventory here. Is that correct?
I've used Maslow's burnout inventory for the burnout side.
Yes.
And then I've used the general health
questionnaire.
Survey,
Yes.
questionnaire
Okay.
for the general health side.
Okay. So you have you put which software are you using for analysis?
The SPSS.
SPSS. Okay. So it's
whatever version it keeps changing, but yeah, whatever it is.
It's SPSS. So that's good. That's good. Yeah. So now when you go to your data set, are you able to do an analysis of gender and burnout, for example?
I've been able to do all the variables there.
Yes.
I've been able to analyze them individually.
Okay, individually.
So I've been able to do age, gender, marital status, education.
Yes.
The challenge that has come up is then I've been asked to do a second level.
Yes.
Of correlation. So what I did is I took religion as the base, as the, I almost want to call it the constant.
Maybe for me, what I would have done, I would correlate all the variables. So age versus burnout, for example, yeah?
No, so I've done those. I've done age versus burnout.
General health.
No, so I haven't done that second one you've said.
So that now, as you do your discussion, you'll be able to say the variables, the background variables that seem to have a correlation with burnout are this one. And then the background variables that have a correlation with general health are these ones. I don't know if you get what I'm drifting through.
So I hear you. So I was a bit sneaky. Oh, maybe I'll get caught, but my objective. So the first two were just on the burnout and the social demographics, right? So if I look at my objectives, it's one, is there a burnout? And then how does burnout relate with the social demographics? Okay. The last one, I just wanted to check, how does burnout relate to general health?
Okay.
So meaning, I've basically said the study around general health and its impact and everything else should be further research. That's for those who want to do PhD and they want a topic.
So we go to your objective 2. Your objective 2, you are measuring the background variables, their relationship with burnout. Is that correct?
Yeah, so burnout versus the social demographics only, without relating to general health.
Okay, so meaning gender versus burnout. Did you see differences?
Yes.
And is there any correlation?
Yes.
Age versus burnout. Did you see differences? Is there any correlation? So marital status versus burnout, religion versus burnout, education level versus burnout, and then duration versus burnout.
Yes.
So you've been able to do that statistically.
So I've done that first level.
Yes.
The question that then came is,
yes,
do a second level. So for example, take religion.
Yes.
And then now do if I'm Christian.
Yes.
And married. If I'm Christian and age X.
Aha. So now that will now depend. It will depend.
Then my supervisor now has said go to level 3.
Yes, yes.
So now do a third iteration that says if you're daktari, you're male, you're Christian, and you're married, what happens? Now that's where I'm totally lost.
Okay. I think in such instances, you are allowed to seek the assistance of a statistician,
which I'm doing.
So because what is happening the person will just put what you want they will input the different variables of what you want onto the SPSS, and then SPSS will either produce for you a table or a graph reflecting that. We are together up to that point.
Can you hear me?
Yes, I can hear you. So no, I'm saying,
I think you can hear me.
Yes. So as you put in these different variables onto the software will be able to demonstrate. The software will bring out the relationship, demonstrate the relationship between the background variables and the independent variables.
So I guess where I'm stuck is when I start doing the 2-level, 3-level.
Yes.
It can take any form of permutation.
Exactly, yes.
And then the second, so as a result, my literature review or supporting literature, I'm not getting the permutations that support whatever is being done. So I'm kind of stuck in a circle that's saying, I can keep checking, are you male? Are you between 25 and 30?
Yes.
Are you X? And running it against a certain variable.
Yes,
yes. So I'm a bit stuck on this examining relationship, that objective 2 right now. If I had a choice, if I could kill it, I would have found a way, but I'm married to it.
And unfortunately, that seems to be the simplest objective of your 3 objectives.
So my problem is now when I've gone to that 2-level, 3-level.
Yes, yes.
So you see, so now like my second level was assume religion because it's DASTA. So assume Christian.
Okay.
So I've already run Christian against age, marital status, level of education.
Yes.
Another one, work experience, I think. Yeah? So
do you have the report from SPSS for that?
Yes, I do.
Maybe do you want to display it on the screen? I don't know if you're able to retrieve it.
That would be chapter 4, right? I am trying. So I have it. Okay, so that's okay. As I'm looking for this,
so as she's retrieving that, what is the rest of the group picking from this conversation? What are we picking from this conversation, Chris?
That research is a character development process.
I agree, Chris. I agree.
No, a specific picking, not just general. A specific picking. What are you picking from her study?
Well, it's interesting. You see, for me, I haven't reached there. So, but that thing about the correlations, that one, you can do that. You can, correlate any of the variables to, to another variable, or
Yes,
even
yes.
all. Yeah.
Or even all. Yes.
Yes. Yes. And still get.
I don't know if you can see that right now.
Please just go ahead as.
No, so I don't know if you can see that. So what I got out.
We can see it. Yeah.
Okay. So that's just the first one. So that is just gender, male, female. So I don't know what table you would like to see. So I just went to one of them. Yeah. So I mean I've broken it down in different ways. So okay, let's start with this one. It's the easier one. So
the
on prevalence, yeah. And then I went ahead to check it by. Sorry. Oh, this feels, Chris, I'm gonna sue you for this. Okay, I think it's the table I want to use. Yeah, so I've done this. I've done the correlation. No, so I've done the correlations. I've done the you can see
the chi-square.
I've done the correlations and everything. I think the one I just want advice is, let me go to what I was asking, the two level, because the others are simple. Then there's nothing too annoying. I don't know what it is. It's missing. It knows you're here, Doc. It knows you're here. It won't come up. It won't come up now. No, it won't come up now. Yeah. So no, so I don't have the data itself, the data dump itself. At least I can't see it now.
Okay. I'm trying to.
So I think ask a specific question and I see if I can answer it. Because I can't see the report that I need to.
What did the supervisor specifically say, if I may repeat?
Sorry, I may have missed you, Doc.
I'm trying to understand the feedback from your supervisor.
So the feedback from my supervisor is.
Yes.
No, I found it. Like I said, once you get off, once the doctor is not looking there, the medicine is found. Let me try and put this up now. So what the supervisor came back with is, you've done the first level of demographic, what do you call it, of correlations. Huh?
Yes.
So she's then said, go back and do a second. Coexisting relationship.
Okay. Did the supervisor talk about analysis of variance?
So so she said, so this is where she came from. This is where, go do a 2-level relationship. So I said to her, okay, I'll hold religion constant because we are Daystar and we are few Muslims. So I'll do religion versus all the variables. So religion versus gender versus age, etc. Yes, so that's the table that is now on the screen.
Okay. Oh, so you will hear words like multiple regression or analysis of variance.
So now I'm at that space. I'm at that space now for do. So for this 2-level, we just did a chi-square, which is what is on the screen.
Yes.
So I've done, if I hold religion constant, you can see what is there first is religion.
Yes.
Versus gender.
Yes.
Then versus age. And then I've gone on to do versus age. I've gone on to do now all the other variables, right?
Yes.
I don't know what's going on here. Okay. Marital status, etc. And then I've discussed this. Now the challenge that is happening is, so the first thing that has happened to me, which is quite annoying, is where I thought there'd be relationships based on the literature review, in some cases they don't exist. And when I say that,
yes,
when I write and I say that, okay, I've done my analysis,
yes,
but it's not saying what it should say. We have a problem. And
not
then I've gone ahead and even done now the third level.
Not necessarily. It isn't a problem. You know why I would say that is because maybe for the specific people you have interviewed, there is no relationship. But if you went to a different sample in a different setting, you might find there is a relationship. You understand?
So I crossed, so you can see what you're seeing on the screen now is a chapter 4, and you can see it's 5 revisions later.
Yes.
So this was just the data. So I reported that. So now when I'm doing chapter 5,
yes,
I have been told now to give literature to support my results or explain why there's a difference.
Now that part,
which of course first has just baffled me totally.
That part I think is how would you say? You might say that my study is not consistent with other studies.
So anywhere where I've said that, what I got back is a question mark saying, go find a study. So that's kind of what I've been stuck for the last 2 weeks.
It means you have to continue doing more literature review.
So the balance, I guess, the question that I've been asking Chris is, does that mean as I'm writing now that I'm in chapter 4 and 5,
yes,
if I find new literature, should I go back to chapter 3 and update it? No, chapter 2 and update it?
Exactly. Because you have not submitted your whole document for examination. So you are allowed actually to update your literature review.
Can I just ignore it and decide I'll just put in new people now? Sorry, Chris, I know I'm hogging this relationship.
Okay, so
this is very useful. It's
so you remember at the beginning of the session when I said when you do your conceptual framework, it influences the whole study. You remember I said that,
No, so I can see it running through.
Yes.
But now on chapter 5, there's a part of me that almost wants to go back and delete certain things, because they're causing me problems now in chapter 5.
Okay, so we go back to your conceptual framework, In your conceptual framework, you have the different variables, so to speak. So for example, we have looked at the relationship of age with burnout, or the relationship of gender with general health.
Yes.
Now you're in your discussion chapter, and you have gone back to literature. As you have gone back to literature, you are also comparing, are there any studies that have maybe looked at the relationship between gender, age, and general health, or gender health and burnout syndrome as 3 variables in one? You understand? Now you are discovering that whatever you had written in your literature review was not, how would you say, was not complete. Was not complete. That's the word to use, yes? Now, if you discover that your literature review is not complete, it is, personally for me, I would say, you update your literature review.
Okay, so update it. But what if I don't find? So for example, what I have on the screen now.
Yes.
If you just read what I've put there now.
Okay. This findings
on marital status. So on the one relationship, marital status and burnout, I found the relationship. But finding someone who has done religion and marital status, I'm struggling.
Religion, marital status, and burnout.
Oh, those two first, religion and marital status. Remember, I'm doing 2 level first.
Okay.
Yes, religion, marital status, and burnout. Yes.
And burnout, yes.
Yeah. So I've looked for research. I can't find those three in that format. So what I've done right now is what I've highlighted is I'm basically, I mean, literally.
What databases are you using?
I've been on ResearchGate. I've been on journal articles. I've been the whole data library.
Like Science Direct.
Yeah, I'm using all of those.
Psych articles.
Yeah.
Wiley.
Yeah, all the above. So I'm using Data, USIU.
For me, I would say keep
searching.
trying. Keep searching, yes. Keep searching.
No, I need to graduate. I need to get out of here. Anyway, so that's been the current challenge, is getting articles when they say go to the first level was not a problem.
Yes.
So it's now when I do level 2 and 3. So if you see level three, I've just lied. I mean, even I know I'm lying. Whatever I'm writing, I'm now just writing. So that's kind of where I'm at. And then the second thing that came up is after I've gone through chapter 4, because she's like what you said at the beginning, send me chapter by chapter.
Yes.
I went to chapter 5, and in I think my second or third draft, this is chapter 5 on the screen, which is 40 pages. I can't believe it. She then said something like, you're not talking about major findings. And so now I'm stuck with 40 pages.
You're not talking about
the conclusion. What? Remember, this is chapter 5, conclusion and findings.
Yes.
The comment has come back that says, please focus on the major findings of the study. So I'm sitting here going like, I've talked about all the findings.
Exactly.
Are you saying then I move things now to chapter 4 and beef up chapter 4 and only leave the major ones in chapter 5?
Okay, I think there's a question about the definition of major.
Exactly. So that's why now I'm stuck. So now first I'm stuck at the level of, I don't see how chapter 5 can be 40 pages. That cannot be a conclusion.
It can, but
so that's why I said, no, that's why Chris is because now I'm stuck totally.
So we need to help you get out of this stuckness, yeah?
Yeah.
So the first way of getting out of the stuckness is to look at your study objectives.
Okay, so that we are there.
You look at your study objectives, yeah?
So I'll put them on the screen. I don't know if my screen is still sharing, but they're on the screen now.
They're on the screen, yes?
Mm-hmm.
Okay, so now we want to know the major findings of your study. Are we together?
So finding 1 is easy because objective 1 is prevalence.
You are looking at the prevalence, yeah?
That one was easy.
That was easy. Okay, good.
So the key finding is there.
Number 2, we go to number 2.
This
is about
the
relationship between burnout syndrome and social demographic.
Actually, can I kill 3 because 3 is easy as well.
3 is easy, yeah?
So number 3, which was analyze the relationship between burnout and general health.
Yes.
That one is easy.
You've done it.
It's here. I can tell you who has, it's the number, that's number 10 there. How many respondents showed an issue and at what level of significance? I have that.
Okay.
Where I'm stuck is this number 2.
Number 2. So this number 2.
That means this relationship.
The relationship between burnout and social demographic characteristics, yes?
Yes. Now, the findings, all the findings are here. So I don't know who isn't.
So now the question that your supervisor is asking, amongst these 8 findings,
Yes.
Which one is major?
Even me, I don't know. This is where Chris helped.
Daktari is there.
No, that's where you see. I am the midwife here.
So that's
okay. But I'm imagining.
I am the midwife, and you're the one who's pregnant with this knowledge.
What do I do? What I have written? So throwing it away is like throwing the baby. I'm just very.
So we want to see
let me listen.
in your own understanding. Yes. In your own understanding, what would constitute a major finding?
I would say major would be at this point anything where if any like this one here, I'd say is not major. Because there was no difference statistically. There's no statistical difference, either the chi-square or the one of those other tests. No difference was found. I think there are like 3 of them that would drop off just on that basis.
Okay.
And you see, at the same time, that's what shocks you, because you see from literature, the effect, for example, gender should have an influence on burnout. But I'm surprised that this is a result I'm getting at the with my population.
Okay, I have a suggestion. Since you have reviewed a lot of literature, regardless of the topic of study of that literature you are reviewing, do you see the style they use to indicate major finding?
No.
All right, I open the question to the group.
Yeah, guys, here I need help. Should I, you know, if I go by this, no statistic for
I open the question to the group because, again, this is something that you'll find yourself having to reflect upon. What is a major finding and what is a minor finding in research? Anyone?
Yeah.
What is a major finding versus what is a minor finding? Thank you, Patricia, for sharing. This is encouragement to the rest of the group.
Yeah, can I attempt, because I don't know I can't say I know the answer.
Yes.
I'm imagining that major findings have to do with the objectives. You know, a finding directly related to the objectives of the study.
Exactly.
And a minor finding is an incidental.
That's why I struggle. Because see, like now this one is on the
however, I have a question. Just because if you find there is no difference, to me it's still a finding. And if it's aligned with the objective of the study, it's still a finding and therefore a major one. That if I don't find a relationship, you know, you didn't, when you were coming into the study, you did not know whether there was a relationship or not. That's what I'm imagining. And then you come and find that there's actually no relationship. See, that's a finding, Dr.
It is a finding. So that's why for me, in terms of major finding versus minor finding for your study, objective 2 was looking at the relationship between burnout and the socio-demographic variables. Yes. Now, was there a finding amongst these variables that was not expected? In other words, you had a hypothesis, you've implemented the study, and you find that this finding is different from the hypothesis.
Yeah, I think that's
Sorry, I'm back now.
Oh,
Patricia, I don't know. Did you experience that?
Just re-ask the question, please.
Okay, so you have collected data.
I have collected data.
Before collecting the data, you had a hypothesis.
Yes.
Now, your hypothesis and your findings, are they consistent with each other or different? I don't know if we should look at those findings that you've given us. The question I'm asking, your findings, are they consistent with the hypothesis?
No, there are a few, like the one I've put up for gender.
Yes. So for me, I think if I was to highlight, I would also highlight those that in terms of, because your hypothesis was like your roadmap, yeah. And now your findings is the journey that you took. You are planning to go to Kisumu for 6 hours, but you found a puncture in Salga and it changed the trajectory of your journey. Then you found another roadblock at Mau Summit. It changed the trajectory of your journey. Now, those are your findings. But I think the challenge that maybe is there is how to, how would you say, demarcate something as major versus something as minor. Because when you talk about major findings, normally we talk about the principal outcomes, we talk about the totality of the study, rather than the conclusion or the recommendations that you can make from the study.
So I guess the question I'm asking, this conclusion section suddenly
looks
bigger than it's look. I mean, I'm at 40 pages, man.
Yes.
And I can't figure out who is major and who is not. So I'm sitting here going like, should I be cutting and pasting back into chapter 4? Reduce content here?
Yes.
Or should I just go with the conclusions at these 40 pages? And I think that's the challenge when you talked at the beginning. The challenge of doing chapter by chapter is that.
Normally, what is going to happen is that once your supervisor, once your supervisor now tells you that you are ready for examination, you have to write, or rather, you have to revise the whole document so that the chapters speak to each other.
Okay, thanks for the heads up.
That is what you're going to do. You're going to revise the whole document so that the chapters speak to each other. Because what might happen is that if you don't do that, it will appear like the thesis has been written by different writers.
Yes.
Yet it is the same person who wrote it.
Yeah, because we know the time. Okay, I hear you.
Yes.
Okay.
So allow yourself to do that, yeah?
So for now, you'd suggest share the 40-page conclusion section.
Yes.
And then based on the feedback I get, then there'll be a session to rewrite and move things around.
Exactly, yes.
Okay, I think that's fair. Yeah, I think I'm less traumatized than I was when I started.
Therapy.
Because at the end of the day, what happens is that it's about the process, so to speak, because the examiners also don't look at, okay, they look at the content of what you've written, but they also look at what process did you go through for you to present what you've written to us. Okay,
one final question. Yes. Do I need to have a hypothesis? What do you call that thing of hypothesis? You know that H not H1. Do I need to have a hypothesis section, or I can just do away? Because it came up somewhere when I was doing my data analysis. I started referring to hypotheses.
Yes.
And now in chapter 5, I've been asked, where the hell did this come from?
Okay, was it part of your proposal?
No.
I think you can have a discussion.
Can I just do away with it and just be happy?
You can have a discussion with your supervisor, but generally for many studies, expected to have a hypothesis. Some people, some schools maybe will tell you, instead of a hypothesis, to express it as a question.
So I have research questions.
Yes.
But I didn't have that hypothesis. So I guess, I think that's what she's asking me, is because the words that she's used is, where did hypothesis come from?
So if your study was purely quantitative,
yes,
hypothesis is normally used.
Okay.
Yeah, so if it's purely quantitative, a lot of, if you look at many of the, whether it's journal articles, dissertation thesis, you'll find a hypothesis is always there. Then sometimes also you look at, are you going to make any prediction? From your study?
No predictions.
Are you making any prediction?
No.
Now, for each research question, because you say you already have questions, yeah?
Oh, so you mean predictions like there is a statistical relationship between gender and burnout?
Yes, for example, yes.
Okay.
So if you're making predictions, then you need to have a hypothesis, because the hypothesis is what we are using to test that prediction.
And that should come in my earlier on, right?
Yes. Then, of course, if you have 4 questions or 3 questions, then each of those questions, you need to make what? A hypothesis.
Hypothesis.
Yes.
Okay, I'm with you. But that would be now when I'm doing the final rewrite, but I can't introduce it at this level.
You know, you can introduce it at this level, because you say because you are reading, you are learning.
Okay.
You can say, as I was reading, as I was even looking at the literature when I was doing the discussion, I realized that I need to have a hypothesis.
Okay.
For each of the research questions. Yes, yes.
Okay, yeah, okay, thanks. I feel I can write tomorrow. As you can see, I haven't touched this for a while, so.
Yeah. So when you're looking at the discussion of the results, maybe what you can learn from you is that you are telling us your own interpretation of what those results mean. Is that correct? Yes?
Yes, I think there's at least one paragraph or so that is my voice.
Yes.
But it
may not necessarily be what it means to you, but what does it mean in relation to other studies?
Yes. Okay. So that is so that's kind of where we are at now. Yes.
Yes. Yes. What does this study mean in relation to other studies? Then, of course, the other question that sometimes we might ask is, why did it turn out like that?
Okay.
Why did it turn out like that?
So what I have is, so I'll put it up on the screen again.
Yes.
So I've tried to, so this is on, married to status. So this is where now, these are kind of places where I have challenges, something like this. How to say this. So the bit that I'm highlighting is what I think is my voice.
Okay.
I think everything else is anchored on something else. So CRT is a conservation of resources theory, which is the second theory I'm using.
Okay, apart from that model, do we have other literature on it? Yes,
yeah, so what I've done, so I've put that little bit there is what I think is me thinking.
Okay.
Everything else, as far as I know, is other people's thoughts.
Okay.
So starting from the study by Chin going on. So like for every section, that's how I've kind of tried to balance that request to have my interpretation of the data and what others are thinking.
So there are those who will, for example, use phrases like reported results on this relationship, show blah, blah, blah. Or others will say when comparing the relationship of academic qualification and burnout, blah, 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 you know. So it's just about the phrasing, eh?
Okay, so it's a bit of, okay.
Yeah, it's just about the phrasing.
Yeah, because one of the things I've been asked is to stop talking about this study and to talk about the findings or the results.
Exactly, okay. Yes, okay. Yes.
So okay, I think I've understood what that is now.
Yes, so we know this is a study. We know it is a study. So we want the specific component of the study. You understand?
Okay. Yeah.
So maybe you would say, when comparing the relationship of academic qualification and burnout, a one-way analysis of variance was conducted. There was significant effect at the p-value of 0.5, blah, blah, blah. These results suggest blah, 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 like that, yeah? and you can be able to talk about it in relation to other studies. Reported results on this relationship show consistency with other studies. So meaning your study is showing consistency with other studies.
So what is driving my supervisor crazy is words like this.
Yes, yes.
So I don't know how to not say this.
So do you have access to the APA guidelines?
Yes, I do.
Okay.
But I've read them, but I don't know how they help me, because like now what I'm saying is, yes, I'm referring to this
they
study,
will help
but the
you.
guide
They will
not
help
go ahead.
Ideally, they will help you in terms of the
phraseology.
The phraseology, yes, yes.
Okay.
Yes, when you're talking about these relationships, they help you.
Okay. I'll spend some time on that, because I know this is like what I've highlighted now is a major annoyance for her.
Yeah, so that's the editing that takes place now, eh? That's the editing. All right, so I think
that's it. Yeah.
With Patricia, I think you are good to go.
Thank
we are learning
you.
from
Thank
you.
you very much. Thank you.
Thank you for sharing. Chris, I think we can take the break now, yeah?
Yes. We can, but it's also been awesome. Yeah, I mean, we've surpassed records. But I did have a question, especially, and thank you so much, Patricia, for your generosity to share your document. I have a question, especially when you're saying about reverting back to the literature review after having some certain findings that you revise the literature, but if that's the finding, why then do I need to go look for literature consistent with the finding?
Okay, I think there is something that is very common with Kenyan dissertations or theses. A lot of times you read the literature review section, you feel you're reading a book review. You feel you're reading a book review. So you'll find someone has put paragraph 1, Adams 2004, paragraph 2, Jones 2000, paragraph 3, Mamba 1997, like that. Ideally, a literature review is not a descriptive summary of books and articles.
Yeah.
It's supposed to be a critical evaluation relating to that topic. So you find the rule of the thumb is we are supposed to avoid discussing one study at a time, because that is what many of us do these days, one study at a time. Instead, it's better to consider several studies by referring to a common factor. So for example, you might say a number of authors have found that, and then you put whatever the hypothesis that you want, or have used this, or have failed to take into account, or have criticized the conclusions, so that someone can see that you just did not read one book on this topic, but you read several books or several articles on that particular topic. So I think that's one of the things that happens, yeah? And so that's why when I say that you're going to update your literature, you might find that sometimes you're just updating the authors who participated in that controversy. You see?
Okay.
Then the other thing that also we look at in terms of the literature, the manner in which previous research is discussed should be considered like anew each time the same study is mentioned. Only if the relevance of the material is not central to your study. Evaluation of previous research also should not be limited to results obtained or conclusions drawn. Sometimes we also look at the methodological aspects such as sampling for instance, measuring techniques, or research design. I'll give you an example. I think in 2020, there was a study on, a national study on violence against children in Kenya.
Okay.
A household survey. It was done in all the 47 counties. USAID versus the Kenya National Bureau of Statistics, they all did this study. It was a big study. It was almost like a census, but it was big, on violence against children. Now, one of the limitations of that study is that they did not look at displaced populations. We have stateless persons, we have refugees, we have IDPs. They did not look at those people. They looked only at people who are living in households, not in displacement. So now if you're doing a literature review, you might say, in terms of violence against children, you might talk about the reported studies that have been done. And you might also now talk about the limitations of these reported studies. That these reported studies have not focused on displaced persons. Or you might say that these studies used survey methodology, when ideally you could have used a different type of methodology. I hope that's clear, Chris.
Yeah, it is. It's getting clearer, and I suppose now that it will now when we get onto our laptops as we are writing, you know, doing, especially when you broke down planning, writing, and editing. I think for me that's the major takeaway from this discussion, that each has its own kind of life, and because I know for me personally, what I've been struggling with is combining all three. And of course, needing, like Carol says, therapy.
So I think one of the things I would advise is that anytime you feel stuck, just look at different journal articles. Either in the topic of what you are studying, or even just generally, and see, okay, I'm stuck in methodology. Let me look at different journal articles. How did they express their methodology? You see, or I'm stuck in literature review. I look at the different journal articles. How did these people express themselves in their literature survey, in their literature review? And for me, it works. I'm stuck in trying to conceptualize the objectives of my study. Let me look at the different journal articles to see how did these scientists express their objectives. Okay. You'll notice there's a language that they used, and with this language, then you can be able to adapt to your study.
Wow.
All right. I hope you have fulfilled your expectations
and surpassed, in my view, and surpassed them. And thank you. Thank you. Yeah, let us close, because I know people are going to work tomorrow and they'll still have to wake up to write their papers. And I'd like to invite Milka to give a vote of thanks, and Anne will close with a prayer. After the vote of thanks, maybe, yeah, before the vote of thanks, Dakari, what would be your, I know you've said many parting shots, but, you know, just give us an umbrella statement about what your experience, what you've had here, what you've seen, and anything else you'd like to say, just maybe a phrase.
For me, I think the important thing is to follow the guidelines of the university if they are explicitly stated. Yeah.
Okay.
If they are not, if the guideline is not quite clear on the issue, follow the APA standard. So you have two documents: the guideline from the department, the APA standard, and the feedback from the supervisor. Now, the feedback from the supervisor is not gospel.
Okay.
I'm repeating again, the feedback from the supervisor is not what? Gospel. You are training to be a scientist, because our programs talk about competent and reflective practitioners, you know. So you are training to be a scientist who has ideas and who's able to express those ideas, but also challenge the ideas of other people. So your supervisor may say this, and you go and review literature and you say, last week we discussed about this, but now, according to some authors, they looked at it like this. And in my own view, I think I'm in agreement with this type of thinking. What do you think? You know, so you have a discussion with your supervisor. Because at the end of the day, when you succeed, they also succeed. You know, it's a symbiotic relationship. Eh? When you succeed, they also succeed, because they'll put you in their CV and say, I have supervised 12 students to graduation or 15 students to graduation, you know. So at the end of the day, you're working as a team together. And as Patricia puts it, your supervisor is the gatekeeper. Yeah. So that will be my parting shot. Follow the guidelines.
Okay.
Yeah.
All right. Okay, thank you. Milka.
Yes, Chris. Well, thank you for giving me this opportunity to actually appreciate our good Dr. Obulutsa. That's a good name as well. I've never had it. And but also, more than the name, he has given us so much of what he has. So I would like to appreciate you, Doctor, for your willingness and availability to allow us to tap from your vast knowledge and experience. We are so grateful. And especially your, the approach that you took, getting us, the conceptual framework and helping us see the end of our results from the conceptual framework where we are maybe at this point. It made it look more easy and more understandable. By looking at it that way, we can now see the true relationship between the conceptual framework and the objectives, as well as the outcome of what we expect of our study. And again, I would, you have helped us look at it. It has made it. It has been, as opposed to being abstract, for allowing our colleagues to present their conceptual frameworks and the titles of their study. It has made it look real, especially to me. That was my experience, that this has been real journey, real challenges, and the real study that is going on as at now. So I would like to thank you and particularly appreciate our colleagues, that is Abel, Tabitha, and Patricia, for letting us learn from your not so easy journey. Yet we have seen from your journey that yes, one, it is possible, but at the same time we can identify with you and see the challenges that we are about to face, depending on our level or our where we are at this journey. So thank you, our colleagues, and particularly want to wish you well. We have realized you have made progress, and we cheer you on to focus on the finish line. Patricia and even Tabby, who is presenting tomorrow. And to Chris, you have always been like a big brother to us. You have taken that role of leading us and getting us good people to guide us and to help us. So we thank you, Chris, for making this happen. Kika tunaendelea kuivia. Like we are getting better every day, especially tapping from different people and their different way of looking at the research. So we have truly benefited. And finally, I would like to thank everyone. See, we have all stayed up to 10 o'clock. A few people have dropped maybe for family issues, but we have stayed on until now. So this would not be a success without you. So thank you so much. Want to wish everybody a good night, wish everybody success in this journey. Tuko pamoja. Personally, I am stuck at ethics, waiting for the UN, KNH UN ethics. Kumbe it's a journey with them. They are taking too long. So I submitted a month ago, and they were not able to discuss it in their last sitting. So it is taking me to August. I don't know what that means to my graduation, but I am hoping for the best.
or maybe I have to look for an alternative. So thank you. I wish you all success, and particularly Tabi, who is presenting tomorrow. Thank you.
Thank you. And for those who can come tomorrow, we can have some coffee at Desta after or during, to just give them moral support. And just to say, our next guest will be, she's in the Writing and Speech Center at the University of Wits in South Africa. So it's going to be about note taking and just pretty much a lot of the stuff, a lot of the say like Dr. Obulutsa has mentioned, and even I will ask about, even maybe the APA guidelines. Yes, we can get the documents online, but how does it look like in practical terms? So that will be our next guest in 2 weeks. So we'll ask Anne to pray for us. Wow, your network.
You can't hear me.
Just try and.
Can you hear me? Is it
down.
better?
Yeah, that's better.
All right. We pray.
Okay.
Our loving Father, we thank you for the gift of health, for the gift of knowledge we've gained through this session. We pray for blessings, Lord, for our generous doctor and for his patience and generosity in sharing the knowledge. Lord, we bless you and we surrender all of us who are at the thesis stage into your hands. May you visit every one of us at the point of need, those who are here, even those who are not able to show up here because they are not confident, because probably they are not yet anywhere. Lord, we acknowledge that you've taken us from so very far, and this last step will not be difficult for you to help us finish. May you meet everyone at the point of need. May you help us to overcome the challenges. We also surrender our colleagues who are presenting tomorrow. May your grace and spirit be sufficient for them. May tomorrow be a victorious day for them. Lord, we continue to pray even for blessings for all those who have come to support us in this manner, and all those even who will come in the future. May you reward them yourselves, because we have what all we can give them is thanks, but we know you can reward them in different ways. We also pray for Chris for the effort he has made to take this upon himself. May you also help him in this journey, so that at the end of the day, we will all be a team of victorious people. Continue to give us health, good health, and provide even financially for us, so that, Lord, we see this journey to the end. We ask this through Christ our Lord. Amen.
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 All right, good people, and have a blessed week.
Thank you and bye.
Bye. All right.
Thank you, everyone. Thank you, Chris.
Karibuni.
Thank you, Chris. Bye. Thank you, Dr.
Chris, I see you're still here.
Just let me
he has a question.